We're very glad to be here at this live panel. My name is Stefano Levi, and we are with Dr. Ruit and Dr. Tabin. We are having some technical difficulties, and Dr. Tabin is trying to get his phone working because we cannot hear his voice.
So, Stefano, do you want me to start with a few questions from the audience, or do you just want to hop into like an update on what's been going on with the project?
Well, I can probably talk from the film point of view. I mean, the film is quite old because it's been shot in 2010. This is actually the first time after we were united in Nepal that we meet again electronically, Dr. Tabin, Dr. Ruit, and myself. So it's very exciting. In 2012, the film was released in German theaters, and it traveled around the world doing many festivals. It won several awards, and it was used as a tool for trying to get awareness about the cause of cataract blindness. And since then, many things have happened, and the project has continued on many fronts. But I think the most qualified person to say anything about the project is probably Dr. Ruit, who's also, his mic is working, and I invite him to maybe introduce himself and to say something about the development of the project.
Hi, Stefano. This is and Erin. This is Dr. Ruit speaking from Nepal. And just to follow on your instructions of questions, since we filmed the Out of Darkness, very well done by you and your team, up in the outbacks of the eastern part of Nepal. I think great strides have, we have moved on. And one of the biggest achievements that we have accomplished is, along with the Himalayan Cataract Project, we have expanded the capacity of the Tilganga Institute of Ophthalmology into the new building, which was funded by USAID and the Himalayan Cataract Project, and which has enabled the output of Tilganga by about 20 times, both in terms of patient capacity and also in terms of training. And we have expanded our areas of reach in many parts of Asia, and Geoff and his team have expanded this in Africa, especially with great strides in Ethiopia. And the concept of taking very high quality eye care, as was developed in Nepal, and making it cost effective and sustainable, and with training of a lot of doctors by the long experience we had in Nepal, had now been translated in many parts of the world. And this has enabled the Himalayan Cataract Project to be one of the most important, I think, developments has that Himalayan Cataract Project has been selected as the semi-finalist for the 100 million, very famous 100 million MacArthur grant. We believe that this is going to enable us to look at the global blindness, global blindness with the experience that we have. So the training program continues, and a lot of subspecialty training programs, and number of doctors coming from all over Asia, Africa, and other parts of the world are increasing. And I think this is all very exciting, really.
Yeah, Erin, if I may add something to what Dr. Ruit says, he's always very humble about what he does. And I think, I've been working with several NGOs, and I think this is really the most efficient and the most effective impact per dollar spent. Because if you imagine that you can literally change the life of a person overnight with $25 and a 5-minute surgery, this is just amazing. And I have not found in these 7 years anything that is more impactful than that. And I think that really deserves the recognition of the 100 and change semi-finalist nomination. And what I learned from Dr. Tabin about this is that the model they have developed for Nepal is actually served to develop a model that is applicable in the future for other countries, meaning that this way of operating and the knowledge they have acquired and the experience they have acquired in working together with the local communities will enable them to really eradicate the problem of global blindness on a worldwide scale. And this is something that I believe in the 90s, when Dr. Ruit and Dr. started this was very far away, wasn't it, Dr. Ruit?
Yes, with a lot of obstacles, and yeah, it was difficult.
I want to emphasize is that Dr. Ruit is really the master trainer and teacher, as well as kind of organizing and linking. So the thing that's really happened, you know, which is so wonderful, is Dr. Ruit's been able to kind of link all of the programs, all of the eye care in Nepal, and that really led to changing the arc of blindness in Nepal. And we're now utilizing Dr. Ruit's skills and system as a main training base for Africa. So it's not just a $25 surgery, it's that we're actually empowering doctors in Ethiopia, doctors in Ghana, doctors in Rwanda, doctors in Myanmar. Dr. Ruit's been training doctors and nurses from North Korea. So really, it's been the training aspect that's really ramped up that's allowing this incredible system of high quality, high volume, and low cost surgery to really spread and expand.
Yeah, Geoff, could you add something? Because what struck me already in 2010 was that the center in the Tilganga Eye Hospital not only serves like 600 people every day, and only the people who can afford to pay for the service, but it also serves as a training center where Western doctors come to Nepal and are trained in order to operate in the field how Dr. Ruit does. Can you explain a little bit how that works?
Well, first let me say that Tilganga is now seeing 1,500 and sometimes more than that patients every day. So it's really expanded. But in addition to being 1,500 patients a day, it's really expanded in the training. And actually Western doctors, especially European doctors, often don't get the surgical volume in training. So they're really training and becoming better at all aspects of surgery, not just learning the field techniques, but Tilganga's become really an international training place for master surgeons. Sanduk, what do you think?
Yeah, I think, you know, one thing, like Geoff said, is we have been able to develop in Nepal a system and foolproof it so that it is really good for a developing country. So we really have a system, not only just a surgical technique, but the whole system of eye care that has been developed in Nepal in view of the facts of looking at these structures of geopolitical and social conditions in a developing world. Number one is very important is governance in these countries. Very often in developing countries you find the governance is very poor. There's a lot of corruption, and so we have really encouraged a private social entrepreneur partnership, which has really worked fantastic. And the other thing that we have been doing is the system of eye care by instituting a very good cost recovery scheme, whereby we make people who can afford to pay a little more, and then people who cannot afford to pay less. But there should be no barrier for treatment for people of any economic or social status. And but this is a great model for making the program sustainable in a long run. And actually not only sustainable, but they really start making a little money out of it, So something like that developed in Nepal, which is one of the poorest countries in the world. We thought, I believed right in the beginning that if we could do in Nepal, we could do anywhere in the world. And that is exactly what's happening. And I think this is a great example of what South-to-South cooperation is. And like, for example, if any doctor wanted to go from America or from Australia or from Europe to work in a third world country, they would probably come to Nepal and see how it is being instituted, how it is being done. So they take a training, not only the surgical technique, but they also look at the systems. And then it's easy for them to go to these places. So the training is imparted for doctors coming from developing country, but also doctors coming from developed country, so that they get the knowledge of how to do it.
That actually brings me to a question. You know, one is, which I'm going to come back to, which I want to know how the both of you met and what that journey was like, but also how have, if any, technological advances helped us really scale this mission, and what type of equipment was available then that's available now, and if you could just shed some light on that.
The biggest technological development, and the thing that Dr. Ruit's been such a genius at, has been taking the absolute best quality that we have in the West and delivering that to the poorest of the poor at a much lower cost. So two different advances. One was something he engineered with Professor Fred Hollows, who was one of his mentors and one of my heroes, which was to bring low-cost pharmaceuticals, but most importantly, low-cost intraocular lenses. At the time Dr. Ruit came to Australia for his final advanced training, the least expensive lens implant on the world market was about $200. And that made it prohibitive for the poorest of the poor. And what they did was they started a world-class factory at Tilganga manufacturing the state-of-the-art intraocular lenses that were selling for $200 to $1,000 in the West, and began manufacturing them for $4
or less.
And that changed the whole economics, well, or less, but I believe the initial, when it first started, and now it's even less. And even the finest, fanciest foldable lenses, which I use here in America, that my patients pay $600 for, an equal quality lens. And we just published an article in one of our main journals called Ophthalmology. They did a prospective randomized trial actually in Australia and showed the quality is exactly the same. And that lens is about $16 manufactured in Nepal. So that was one really big technological jump that really led to a whole influx of other low-cost materials retaining the quality. Some are being manufactured now in India. Second technological advance was really a surgical skills advance. And Dr. Ruit kind of looked at how the best results are gained with the most expensive equipment. You know, in America, if something's 1% better and 100% more expensive, patients demand it. And the way surgery was evolving in America, it was towards the highest tech and the most expensive means. So using a laser to make your incision. Dr. Ruit developed techniques where a very skilled surgeon can mirror the exact same results as the highest tech surgery and giving the same patients the best result with a much lower cost.
Does this technology also aid to how quickly you can perform the surgeries? Because that's something when I was watching the film that kind of blew my mind, is how quickly you can restore sight.
I'm not sure that, that's partially the skill of the surgeon. But one of the big things in terms of the quickness of the surgery is the efficiency of the system that Dr. Ruit developed.
I see.
And it's really, you know, the turnover and how you can do one surgery and then moments later be starting the next surgery, rather than 20 minutes or a half hour between surgery in Germany or the United States.
If I may add something about the speed, the two guys you're seeing here, they are probably the most speedy surgeons you will meet worldwide, because I think that Dr. Ruit's record is even below 3 minutes, if I'm not wrong.
No, I think you're correct on that, Stefano. But one thing I just want to add is that we have some amazing young surgeons in Nepal who've been training under the system and training under Dr. Ruit, who've now, in terms of surgical speed, have eclipsed their master.
Impressive.
Yes.
Impressive.
Yes.
So we have about 10 minutes left. One thing I really wanted to know is, Dr. Tabin and Dr. Ruit, how did you meet each other? And tell me a little bit about that journey, because it's kind of like this very like amazing duo that I think a lot of people want to know about, that origin story.
Well, I kind of thrust myself upon Dr. Ruit. He already started his system in Nepal, and I'd been in Nepal climbing, and I'd been traveling quite a bit in the developing world, and I was looking for a place where I thought I could have the most impact in the developing world. And I saw that eye care was one of the few places you could really cure people and could really make an enormous change in an individual life. And then I heard about Dr. Ruit and what he was starting to do in Nepal. He'd been back from Australia for several years and really had things very well running. And I did my fellowship in Australia under the mentorship of some of Dr. Ruit's mentors and guides. And they sent me over to work with Dr. Ruit as part of my fellowship. And I was so kind of blown away by the system and what he'd started that I kind of volunteered that I would come work with him after my fellowship. And in Nepal, they don't really usually just no. They kind of try to push things away without directly confronting and saying no. And so I mistook Dr. Ruit's quietness for, but the fact he didn't say no. So I kind of came and after my fellowship, really pushed myself onto Dr. Ruit in Nepal. And I think he tried to get rid of me for a while, but we finally became friends and formed a partnership.
Dr. Ruit, what's your version of that story?
I think that's pretty much what he said, and it was like he was saying he was pretty pushy, and I had a lot of people coming from West and other parts, even from developing world, coming for training, and I thought Geoff was one of the trainees who wanted to just come and spend some time and then go for a short trek and enjoy Nepal and go back. But Geoff kept on sort of, giving me calls from back home, where he was in Burlington those days. And, so after repeated phone calls, and I asked him to come over, and I wanted to really test his patience. So I told him to go to a place in eastern part of Nepal, which was in midsummer in very hot. So I think he had enough patience to extend and survive in that heat and do the work and training the local doctors for more than 2 months. And he came back to Kathmandu, and I thought maybe there is something in him. And what I thought was he was he's slowed down a little bit, but he was so active and jumping. And I thought maybe I should utilize his strength and his mountaineering skills. So that's how we sat down in my office and really started Himalayan Cataract project.
How many surgeries to date have you both performed, or the project itself?
Yeah, quite a few, and quite a few. But Erin and Stefano, and what I really think is, if you really understand the clear definition of public health, I think the work that we are doing is probably one of the most impactful in true definition of public health. And there is no other health intervention which has such a powerful impact as the work that we're doing. And it's got not only the training, reproducibility, scalability, but also it has a dissemination, sustainability. It has, you know, it has effects of training, it has effects of business, it has effects of sustaining and helping the economy of the local area. So it has a tremendous public health value, really. And that's probably one of the things I'm pretty sure that the MacArthur people are interested in, you know?
Yeah.
I'm really sure that this is the wholesome effect of our program, you know?
Yeah.
So
Stefano,
I wanted to add something, because we're talking about the number of surgeries, and that because I work together with the Himalayan Cataract Project, I learned quite a bit of details, and I know that Dr. Ruit recently has achieved, I think, over 120,000 surgeries by your own hand. Is that right?
It's close, yeah.
Close, yeah. And Dr. Tabin probably similarly, maybe together. Like
no, I'm quite a bit behind Dr. Ruit. I'm probably in the 30 to 40,000 range.
Right?
But more importantly, it's the people that we've trained, and it's the young doctors who, you know, who we've trained. So if you look at just the number of surgeries the Himalayan Cataract Project has done now, it's probably up around 600,000. But if you look at the people we've trained and the people they've trained, it's well into the millions.
For the people in the audience who would like to know a little bit more, they can go to the website of the Himalayan Cataract Project, which is www.cureblindness.org. And then there is a lot of stories and a lot of statistics, and they can look up at facts. You know,
it's more than just 120,000 surgeries Dr. Ruit's done, because it's the people he's trained, and people he's trained are now doing 3,000 or 4,000 surgeries each year. And those people in other places in the world are actually training new people. So there's a huge ripple effect way beyond 1,000 Dr. Ruit has done.
Yeah. So I understand we are slowly wrapping up. So I think there is a couple of useful information that we would like to share with the audience. And one is the book Second Sons by David Drelling. David Drelling is also protagonist of the film Out of the Darkness. He's the author, and you can find his book. He unfortunately, very unfortunately, he died in 2013. It was a big loss for everyone, but the book is basically his last work, and it tells about the lives of Dr. Ruit and Dr. Tabin. It is an incredible piece of art, I believe. It's most inspiring and very entertaining, and it really describes the lives of these two extraordinary doctors. And then if there is any other question, maybe regarding the film airing, I'm happy to.
Yeah, absolutely. We have just a couple minutes, and Stefano, one thing I really wanted to ask before we go is what has been the impact of this film on your work, or has it helped raise awareness and help drive more people to donating to the project? Stefano, I'm not sure if you're the best person to answer that, but if you want to start, you probably know some impact stats.
You see, from my perspective, the work, the film was the beginning of a new chapter in my personal and professional life. It was actually my first film. It was really, it came out of my heart's wish to tell this fantastic project to the world. But it also was used as a tool, and was used by many associations and organizations, not only the Himalayan Cataract, but many other organizations, to gather people and to tell about this problem, or to raise money for the cause of blindness. For the Himalayan Cataract Project, for the Fred Hollows Foundation, for different organizations. And this is something I'm really proud of. It's for me, it has more value than any award, because I think that is what filmmaking should be about. Documentary filmmaking should be about. Personally, I don't quite think I will find a story this beautiful. Yeah. So I haven't done any other film for cinema, because it's just it's hard to top this one, kind of. But this has opened my way, and you know, I've developed myself and now own an agency, ChariCom, which we help charities have a bigger impact. And I think Out of the Darkness was instrumental in bringing me on the way of doing this. You know,
for our viewers who are SIMA Rama members, we have a Take Action Kit on the website where you can see a link to the book that Stefano mentioned, as well as several links to the Himalayan Cataract Project. And so before we close, Dr. Tabin, Dr. Ruit, do you have anything else to add?
Well, just what, you know, an amazing filmmaker Stefano is, and how lovely it was having him tell our story. And he just a wonderful, compassionate job. And and Dr. Ruit, I think, joins me in saying just thank you, Stefano.
Thank you, guys. Yep. It's all yours.
Stefano, you know, I mean, I just join in saying that you were pretty young at that time, but you're full of, you know, energy. And what I really saw, an extra thing in your work was a bit of a compassion.
Yes.
And that really sort of spelled out in the final product of the movie, you know?
Yeah.
That was great.
The number one ingredient to a good impact documentary, empathy and compassion. Well, I think that that's a great note to end on. I want to thank you all for your time, and we will probably have a few more questions that I may send via email or in our forum following up from our members. And I think that's it. Thank you for your time, Stefano. Do you have anything else to add?
Thank you so much.
Okay. Wonderful.
Bye-bye.
All right, take care. Bye.
Bye. Bye.
Bye.